If your body isn't making any insulin or not making enough, your body cannot convert sugars into fuel in your body's cells. This condition is called diabetes, and it's a growing concern due to problems with exercise, lifestyle and diet. Diabetes is a condition where the amount of glucose in the blood is too high because the body cannot use it properly. Glucose comes from the digestion of foods containing carbohydrates and is produced by the liver. Carbohydrates come from many different sources, including starchy foods such as bread, potatoes, fruit, dairy products, as well as sugar and other sweet foods that we eat. Insulin is vital for life. It's a hormone produced in the pancreas and helps the glucose to enter the cells, where it's used for fuel and energy for our work and play. Our body will produce this, and the insulin acts like a key to unlock the body's cell so they can accept the glucose. Diabetes UK say that there are about 4.9 million people with diabetes in the UK, and more than 850,000 people have the condition, but it's not yet diagnosed. They also predict that this will rise to 5.5 million by 2030. Figures do vary from other organisations, but this is a serious number of people and families affected. There are two main types of diabetes. These are type 1 and type 2. Type 1 diabetes develops if the body is unable to produce any insulin. This type of diabetes usually appears before the age of 14, but it can occur later in life. Type 1 diabetes is the least common of the two main types and accounts for around about 8% of people with diabetes, as stated by Diabetes UK. You cannot prevent type 1 diabetes. It's not caused by diet. It's usually controlled and tested by injecting regularly with insulin, along with exercising, carb counting and eating a healthy, balanced diet, and also making some lifestyle changes. Type 1 diabetes is an autoimmune disease, and the pancreas cannot make enough insulin because the immune system attacks it and destroys the cells that produce the insulin. Signs and symptoms are things like exceptional thirst, dry mouth, frequent urination, loss of weight, weakness, tiredness or blurred vision. Type 2 diabetes develops when the body can still make some insulin, but not enough, or when the insulin that is produced doesn't work properly. This is known as insulin resistance. In many cases, this is linked with being overweight. This type of diabetes usually occurs in people after the age of 40, although some South Asian and Afro-Caribbean people can often have it as young as 25. However, recently, more and more children are being diagnosed with the condition, even as young as 7. Type 2 diabetes is more common, and it accounts for around about 85 to 95% of all people with diabetes. Signs and symptoms are blurred vision, cuts and sores that take a long time to heal, itching skin, yeast infections, excessive thirst, dry mouth, frequent urination, and leg pain. If treated correctly, diabetes can be controlled very well with insulin, tablets, diet, and lifestyle changes. When things go wrong, there are two main conditions: hyperglycaemia, when the blood sugar levels are too high, and hypoglycaemia, when the blood sugar levels are too low. With hyperglycaemia, this is a very serious condition, and you need to call for an ambulance as soon as possible. If they become unresponsive, place them in a recovery position and monitor their breathing and their response levels. It's usually slower onset. It can take over a few hours or maybe days, and the signs and symptoms can include the need for frequent urination, drowsiness, nausea, extreme hunger and or thirst, blurring of their vision. They also may have a fruity smelling breath. Sometimes this is referred to as cheap wine or the smell of pear drops. With hypoglycemia, sit them down, give them some sugary drink, food, fruit, or maybe just a glucose tablet or gel. You need to monitor them, of course, but you'll see that giving the sugar usually does bring them round fairly quickly. If they become unconscious, put them in a recovery position and call the emergency services. Signs and symptoms are usually very quick onset. These can be things like shaking, fast heartbeat, sweating, anxiety, dizziness, extreme hunger, weakness, tiredness, and irritability. If you're not sure whether the sugar levels are too high or too low, give them sugar. It won't hurt them. If their blood sugar levels are too low, giving them sugar will increase their blood sugar, and you'll get a response fairly quickly. If they're too high, their body won't be able to use the sugar, so it's not going to do them any harm.